I am still a little bit out of it from my Spravato treatment, but let me tell you what happened. So I set my alarm clock. I get up early. Normally they don't get here till like 8:40, but this guy got here like super early, like at 8 o'clock in the morning. I'm like, oh my goodness. And my stomach is still messed up, so I'm still having diarrhea. But I'm like, give me just a couple minutes. So I arrive at my 9 o'clock appointment at like 8:15 for my 9 o'clock. They know I'm here early. And I wait. And I wait. And I wait. I probably used the bathroom like 4 times waiting. It's 9 o'clock. They're not calling me in the back. I'm like, what's going on? I got here early. But that's okay. It's 9 o'clock. I'll give them a minute or two. 9:05. 9:10. And it was past 9:10. I'm not going to say it was exactly 9:15, but it was past 9:10, maybe like around 9:12 when they finally called me in the back. I was like, where's Jenny, my doctor? Because she's the one who gives me this Spravato. And they don't, like, that's another thing. You put it in yourself. Like this Spravato treatment, ketamine, like they hand it to me, and I'm the one who has to put it in my nose and sniff it up. They just hand it to me. That's all they do. They don't really administer it. Okay? There's a point to this. So the lady that normally takes me to the back, she's just the nurse, and she takes my vitals. I was like, we're running late. I was like, I need to get this going. I was like, where is my doctor, Jenny? She's like, oh, well, she's not going to do the treatment today. And I'm like, okay, well, who is? And she's like, yeah, it's going to be Dr. Hicks. I'm like, Dr. Hicks? He is my official psychiatrist. And Jenny is just a physician's assistant. Well, Dr. Hicks, I'm not crazy about, and I have my reasons. I didn't like him over 10 years ago when I had him. So I'm waiting and waiting and waiting and waiting. I'm like, ma'am, you realize that my ride is going to get here. My ride's supposed to be there at 11. But I actually made it at 11:30. But they think my ride's going to be there at 11. So technically from 9 to 11, that's 2 hours. And when they give you this Spravato treatment, it stays in your system for 2 hours. Like you cannot walk, or you can't even walk for 2 hours. Forget driving. You can't even go to the bathroom. And I'm waiting and I'm waiting. She's like, yeah. Well, I was like, so why is Jenny off today? Did she call in sick? She goes, no, she just doesn't work today. She's off. I'm like, if they knew she was off today, why didn't they tell me this? I'm like, well, then where's Dr. Hicks? She goes, well, he's seeing patients. Oh, he's seeing patients. She's like, just don't, she's like, you worry too much. Just calm down and relax. I'm like, I have a 9 o'clock appointment. I got here early. The doctor that's supposed to give me the treatment, and that's all they do is hand it to me, and I stiff it up my nose. I was like, you lady, the nurse lady, you could just hand it to me. Because guess who gives it to me? I do. I shoot it up my nose. And then they give me another one and I shoot it up my nose. Hello? It's not like a doctor needs to give it to me. I'm the one who's doing it. I'm giving it to myself. They do that for legal purposes. So that way, later on, if I ever have something, they can say, well, you actually gave it to yourself. That's what I think. I'm waiting and waiting. Then I hear Dr. Hicks. Then they're chatting and chatting and chatting. I'm like, do these people realize that my ride is going to show up? My ride's supposed to show up at 11. But I changed to 11:30 because sometimes I'm not well enough to leave at 11. I'm still waiting. And they're chit-chatting. He comes in the room. He's like, how are you doing today? You feeling okay? Blah, blah, blah. I'm like, sir, with all due respect, can we get this started? I was like, I don't have much time. He like looks at me like, like, are you trying to rush me? I'm thinking it's 9:45. This when I put this in my nose for 2 hours, I cannot walk. I can't even use the bathroom. You're supposed to put it at 9. Now it's 9:45. 9:45, 10:45, 11:45. Now we're at 11:45. My ride's supposed to get here at 11. Lucky for you, I changed it to 11:30. 9:45, 10:45, 11:45. 11:45 is not 11:30. So I was like, well, I had some questions for Jenny. I was like, considering the fact that she's not here and this is running late. He's like, we're not running late, Mr. Robertson. You need to just try to calm down, relax. I'm like, why are these people telling me to calm down? Are you on island time? Because I'm not. I'm not on island time. I'm on, this is a medical treatment. This is important. So, as he's giving him to me, he's like looking over what I wrote Jenny. And I was like, Dr. Hicks, I was like, because you have to put it in the nose and then wait. I believe it's 2 minutes and then put it in again. So in those 2 minutes, I was like, sir, really quick. I was like, and I spoke for 2 minutes and then he gave me the other treatment and I put it in my nose. And then when I was done, I hurried up and talked quick. Because then the treatment's going to be in me and then I'm going to start, ooh, and then I'm not going to know what I'm talking about. So, by the time I had it up my nose, it was not 9:45. It was more closer to 9:50 instead of 9 a.m. And I'm going to get into the big problem here in a minute. You haven't even heard the big problem yet. So, I'm telling him like a couple things. I was like, first of all, the Zoloft I'm still having diarrhea from. I was like, can you bring me down to the 100 that you want eventually me to be on? Because you have me on 50. I was like, I want to go back down to 25. I was like, but he was the one who wanted me to go to 100 and knew I had diarrhea. And he tells me, well, the diarrhea is not going to go away. I'm like, how do you don't know that. He's like, because if it hasn't went away after a couple of weeks, then it won't go away. That's not what the internet says. The internet says it may take up to a month of being on this. And they also switched me to a higher dose quickly. I was like, don't you think it would be better to bring me back down to 25? Just let me be on 25 for 2 weeks. See how my body adjusts. He's just sitting shaking his head no. He's like, no, we have other medicine for you. Have you got your EKG? I'm like, no, I haven't got my EKG. I was like, did you put the order in? He goes, I believe I did. He was like, besides, you don't need an order for EKG. And you don't need an appointment. You just go down there and tell them that you need an EKG. I'm like, this man is loony now, okay? I think he's been working for the psychiatric hospital too long. I think he's becoming a loony bird. Look what happened. I have a color shirt on and it's brighter. So I think he's a little bit of a loony bird. I'm like, sir, because I have the hospital that I have, there's an app, okay? And the app tells you all your appointments, everything that's going on, future everything. I was like, sir, I look at the app every single day. You have never made an appointment for me to get an EKG or you have put an order in. Otherwise, I would have known. He was like, well, I believe I talked to you about it. I said, you told me 2 weeks ago that you were going to put an order in for EKG. He goes, so obviously then I did. I'm like, again, it's not on the app. No one has contacted me. So he's telling me, well, you just go down there and tell me you need an EKG. I'm sorry, it does not work that way. You can't just walk into an EKG and say, hi, how y'all doing today? I need an EKG. No, he has to put the order in. And then they're supposed to call me and or schedule an appointment. He never put the order in. So I'm like, well, I don't want to argue with them. Because he is the head guy of the psychiatric place. Believe it or not. He's old too. But I had problems with him when I say, it was probably like 15, 16 years ago I had issues with him. Because he remembered me. And I played off and said, I don't remember you. Oh, I remember him all right. So, I was like, well, I was like, you're right. I'll just go down there on my convenience. You're right. I can just walk in on that. And I'm thinking he's full of shit. And I'm trying to like rush this because I already have the ketamine up my nose and it's going to start affecting my thought. You know, I'm going to be high as a kite on ketamine. So I won't be able to construct sentences correctly with this guy. So I told him, I was like, okay. So I was like, so what is the EKG for? He was like, to see if your heart's okay so I can put you on some really good medicine. I'm like, sir, instead of putting me on medicine that I might not feel comfortable with, that may affect my heart, I was like, there's a lot of SSRIs out there that I have yet to try. I was like, why can't we try those first? He's like, well, if you've had diarrhea with the Zoloft, then you'll have diarrhea with all the SSRIs. They're all the same. I'm like, that's not true. Just because one SSRI gives you diarrhea does not mean that they all give you diarrhea. He was like, well, because you got diarrhea with one, then more than likely the rest will give you diarrhea as well. I'm like, we don't know that. What's worse? Messing with your heart or having diarrhea? I think messing with your heart's more important. So instead of trying me on another medicine that might give me more diarrhea, and diarrhea again, we're just going to forget about that and put you on medicine that might screw up with your heart. But we need to give you an EKG because it's that serious. I'm not playing that. This is my health. You don't fuck around with my health that way. So I told him, I was like, sir, I was on Prozac for years and I didn't have no diarrhea. And that's an SSRI. You just got through telling me that because Zoloft gives me diarrhea and it's an SSRI, that if I try other SSRIs like Zoloft, I will get diarrhea. I didn't get diarrhea when I was on Prozac. Totally ignores me. Totally neglects, whatever the word is, not neglects, but neglects what I have just told him. I'm like, this is also my 8th Spravato treatment. I only get 4 more and then I'm done. I was like, why aren't we doing more? I was like, I was told that this would help me after the first or second or third treatment. Then when it didn't, then I said 5 or 6. Then I was told 7 or 8. Then I was told some people have to get up to 30 or 40 treatments to finally see results. Since I'm not seeing results after 7 treatments, today was my 8th, then why don't we just keep quitting cold turkey after 12? This is my 8th treatment today. You had me for 4 more, and then we're over with the Spravato. I was like, what if it takes 15 or 16 treatments for it to finally kick in? I was like, we're not going to know if you're just going to quit me cold turkey. He's like, well, that's just the procedure is 12. I'm like, that is the normal procedure. But I was told there are people here that didn't get results and they had to do them longer. I belong to a Facebook group for Spravato. I've already talked to hundreds of people, like a week. They have told me that if the Spravato doesn't work after 12 treatments, it's possible it may never work. Or get a few more. There's a lot of people said I almost gave up, but by the 15th or 16th or 20th treatment, that's when it finally kicked in. Why are we quitting so early? He's like, but because I want to move on to other things. I'm like, oh, you want to move on to other things. But do I want to move on to other things? I want to stay with the Zoloft and lower the milligrams and see if my diarrhea will adjust. If it doesn't, I want to get on another SSRI. But that's another thing too. I told him, I was like, so what do I do until you put me on this medicine that might affect my heart? He's like, what do you mean? I'm like, do I just get off the Zoloft? He's like, yeah, it's giving you diarrhea. I'm like, aren't you supposed to taper off of that? Not really. Not really? Not really? I know I haven't been on it for a long time. But you don't just quit an SSRI. I've been on it for almost 2 months. And I'm on 50. It would be better to go down to 25 than 12. And that would also see if the diarrhea, it would be killing two birds with one stone. If I went from 50 down to 25, that would taper me down and also see if my diarrhea symptoms goes away. And in 2 weeks, if they go away, then I can stay on the medicine. If 2 weeks they're still there, then I go down to 12. And then 6. And I taper off. And then you put me on something else. This is the head guy of psychiatry. It gets worse. It gets worse. So then he gives it to me at around 9:50. Now, I'm supposed to get it from 9. And normally at 11 a.m., I already want to start walking. And the girl that runs, the nurse, she always tells me, she's like, sir, your ride's not even here yet. Just give it a couple more minutes. 9:05, 9:10. Just to make sure, because we don't want you to fall. So that's a full 2 hours, like from 9 to 10, and then, from 9 to 11, and 11:05, 11:10. To make sure it's out of my system so I can walk. He gave it to me at 9:50 in the morning, not 9. At 10:45, he's in my room talking about, can you get up so you can walk? It hasn't even been close to 2 hours. And he's like, just try to get up and walk. I'm like, does he want me to fall over and break something? I'm like, I don't think I can get up. He's like, just try it. He was like, I think you'll be okay to walk. This medicine takes 2 hours to get out of your system. You gave it to me at 9:50, and now it's 10:45. It's been, almost an hour? Not even an hour? It normally takes about 2 hours, 2 hours and 5 minutes, and now it takes less than an hour. I'm like, I cannot get up. I'm not going to get up. I was like, I'm not going to fall over. And I told him, I was like, I'm not going to get up. I was like, it's dangerous. My health is important to me, and no, I'm not getting up. He just went like that and just walked out of the room. They just walked out of the room. So then I try to get up. Still, I'm like all over the place. Because he gave it to me so late, finally, when my ride shows up, my ride actually called me early. And I called him back, and I was all drugged up. I was like, did you call me? He was like, yeah, I'm just seeing if you're done early. I'm like, I'm not done early. If anything, I'm going to be done late. He's like, late? He was like, well, it says to pick you up at 11:30. He's like, but normally we pick you up at 11. I was like, yeah, well, normally you pick me up at 11, but sometimes y'all are 5 or 10 minutes late and I can make it. That's why I switched it to 11:30. But I didn't get my treatment today at 9 a.m. like I was supposed to. I didn't get it till 9:50. I was like, and I'm still drugged up. So he gets there at 11:30. I'm still not be able to walk. At 11:40, I'm normally out of there at 11 to 5. At 11:40, I am staggering. I am literally falling over. I think the whole room is turning right side and left, and I told the nurse, the one that says come back and gives me my vitals, I can't remember her name. I was like, ma'am, I literally think this room is turning sideways. I was like, the medicine is still in me. I was like, do y'all want me to fall? She goes, I don't. I said, no, you don't. I said, but Dr. Hicks makes out like that he don't care. I said, because he came into my room at 10:45 talking about get up. She's like, yeah. And so I talked to her. I was like, I don't like Dr. Hicks. I was like, how would I go about seeing someone else? She goes, well, unfortunately, she's like, you know how you have the hierarchy thing? I was like, yeah. She goes, well, I'm here. This is your PA that normally gives you Spravato. And then way up here is Dr. Hicks. He's with the treatment-resistant depression group. He's the one who's over the Spravato and that other thing that he wants you to do with the magnets that he wants you to do. That they already put a prior authorization in without even asking me. They even asked me if I want to do that or not. What if I don't? You know? They didn't even talk to me about it. Tell me what it is. They just ordered it and then pushed the insurance to pay for it. And so, so she was like, I'm not telling you can't switch off of Dr. Hicks. She goes, but if you do, she was like, then you won't be able to get no Spravato treatment. You won't get the magnetic treatment. She goes, she actually said the word unfortunately. She goes, because unfortunately he's over all of that. I was like, well, she goes, but we have a new person coming in July. She goes, but we don't know if she's going to be permanent. I'm like, is he going to retire anytime soon? She goes, oh, he's retiring in December. I'm like, thank God. I was like, maybe I should just put everything off into December. She's like, in other words, like, she's not saying no. She's not saying yes, but she's kind of being like, you know, she didn't say, oh, well, don't be so dramatic. Or, you know, she was just like, in other words, like, hello, if faces can speak, and they do, if expressions can speak, and they do. She's agreeing with me, but she doesn't want to lose her job. And she doesn't want to talk bad about the doctor. Which I don't blame her. I wouldn't want to lose my job either. But this is the kind of bullshit. I mean, can you imagine? My appointment's at 9 to 11. I get there. The lady that does it is not even there. They don't even tell me. I asked her, I was like, is she sick or something? She goes, no, she's just off today. You know, and then had me sit there. Plus they were late getting me. Because I got there early. They normally, at 9 o'clock sharp, they call my name. They put me in that room. They take my vitals. The doctor comes in and they start the treatment. They're like, we got to get this going because you got to be out of here by 11 and you got to walk in your ride. They're on time. And I don't get it till 9:50. And if it's 2 hours that you have to wait, 9:50, 10:50, 11:50, he should have walked in that room at 11:50 and said, can you walk? Not at 10:45. 9:50, 10:45. That means I wasn't even on the medicine a full hour and he's asking me to get up. And this is the head guy of psychiatry. Then you ain't heard nothing yet. You ain't heard nothing yet. I'm like, well, I was like, I don't even know if I feel comfortable getting on a medication, sir, that might mess with my heart. I said, but until I get the EKG, I was like, you just want me to just get off the Zoloft and not be on anything. He's like, well, you know, they have other things. He was like, why don't I just put you on mirtazapine? This guy gave me mirtazapine. He was the same doctor that gave me mirtazapine like 16 years ago. And I slept 36 hours. It's well documented in my record. Well, is that so bad? He can't remember that. It gets better. He did that, and it's in my records, that I slept 36 hours on mirtazapine. Just recently, he prescribed it again, like a few weeks ago. And I said, sir, I can't take that. And the medicines that I can't take, allergies. It's under allergies. He's like, well, you slept 36 hours. Maybe it'll knock you out and help you sleep. I took a little tiny piece of it. There's a video I've uploaded on my YouTube channel. I took a little tiny piece of it and slept from 7 o'clock at night till 8 p.m. the next day. Woke up and literally fell. Literally fell and hurt my shoulder. And the same doctor is telling me, well, you know what? I could put you on mirtazapine. You've already done it 16 years ago and just recently, and I fell, and again you want to put me on it? What is wrong with you? I know I have mental problems, but there is something wrong with you. I'm like, sir, why would you put me on mirtazapine? I was like, that's the same medicine I was on 16 years ago. It's in my medical records. I slept 36 hours, but then you told me to get on it again, and I fell. I literally fell. I was like, and you want to try that again? He goes, oh, was you the one that I... Really? I mean, we're not talking about, oh, was you the one who ordered the hot dog and not the nachos? And you mess someone's order up and they get pissed. But let me ask you a question. What's really more important? To mess someone's order up with food or to mess someone's medicine up with medical? People get mad when they mess up their food order. I'm more vigilant when it comes to them messing up my medicine and my medical. You're going to tell me to put on a medicine that I was on years ago, slept 36 hours, says I can't get on it. But then just recently you put me on it again and I fell and hurt my shoulder just a few weeks ago. And your response is, well, I'll just put you on mirtazapine. You just did again. This is what I'm dealing with. This is the kind of shit I'm dealing with. Then, during my treatment, my phone kept ringing, that's not on them. That's on me. That's on me for leaving my ringer on. So it was hard for me to get insight because these treatments seem to be giving me these like visions. Only when I close my eyes. If I open up my eyes, I don't see stuff. But when I close my eyes, I see stuff. And it's trying to like help myself conquer these mental problems, such as depression. It can help with anxiety, but it's mostly used for depression. So, I'm just like, I just cannot believe, I told the driver, he's like, when the doctor told you to get up and walk, you should have, and you should have fucking fell over, and then you could have sued the damn hospital because you got hurt on their property, and he told you to get up, and they could look in the records that he gave you the medicine, and after just 1 hour, he made you walk, or told you to walk, and knowing that they should have waited at least 2 hours. Because they're really strict. Normally, they're really strict with that. That nurse that brings me in the back, I get my provider treatment at 9, and when it's 11 o'clock, I try to get up, and she's like, no. Are you sure you can get up? And he wants me to get up in less than an hour later. You give it to me at 9:50 and at 10:45. That's 55 minutes. After 55 minutes of being on this, you want me to get up? Are you trying to fucking kill me? But you're the same doctor who also put me on medicine that made me fall over after you were told it made me sleep 36 hours. You're the same doctor. And you want to put me on it again. The same doctor that's telling me that because I have diarrhea with one medicine, then all the SSRIs are going to be like that because you had diarrhea with that one. When I was on Prozac and it was an SSRI and I didn't have diarrhea. The same doctor that when I try to talk sense into him and say, let's go down back to 25 milligrams, let's try that for 2 weeks and see if my symptoms get better. If not, then let's taper down to 12 milligrams and eventually get off of it and get on something else. But yet he wants me to quit cold turkey, doesn't care about the side effects, and put me on medicine. Out of all the medicines that are out there, he wants me to put me on medicine that might be detrimental to my heart. So that's why I need to get an EKG. How many people need to get an EKG before starting on an antidepressant? Hello? Think about that. Think about that. How many people need to get an EKG before they start antidepressant? Am I some fucking guinea pig? What the hell is this guy's problem? But this is the shit I'm going through. This is the and people don't like wonder why I'm so negative or why I'm so salty or whatever the fuck. Yeah. And I probably left something out because I'm halfway loony from, but it's pretty much out of my system now. At least, you know, I mean, it's still in my system, but as far as my thought processes and how I can understand things with the mind, it's probably 97% out. So, and the thing is, I'm talking to him, and the medicine's already kicking in. So even though I'm a little bit loony, I'm still in my right mind. He hasn't taken anything, unless maybe he has. And he's the one who's off his rocker, not me. So that's my little gripe on the shit I'm dealing with.